everyone. We studied SARS, the 2002 to 2003 outbreak, and then along with that, the globalization and disease spread. And I'm Anessa.
I'm Isaac.
I'm Eric.
Oh, I'm Lauren.
I'm Kyle.
So what is SARS? SARS is also known as severe acute respiratory syndrome, and it's a viral respiratory illness that emerged out of China in 2002, which kind of had a similar effect as COVID. Some of the symptoms was persistent fever, chills, dry cough, malaise, which is also known as fatigue, and headaches. And thinking about ways that kind of it started is during this time, China was moving towards a more industrial and modern society, starting in the late 19th century, early 20th century. They tried to improve things such as trading, transportation, and adopting more modern practices in general. How did it start? Well, I'm going to give the short version because we'll talk about it more later in the presentation. So it just kind of started at this hospital in Southwest China, was starting to transmit through there, and some ended up in this hotel in Hong Kong, and just was transmits through many people that ended up going to different locations throughout the world. And our question that we kind of was thinking about was, did globalization and industrialization in China correspond to the increase in spread of SARS during the 2002-2003 outbreak? And our hypothesis is that globalization and industrialization increase the likelihood of the transmission and spread of SARS. And some things to think about when studying this was globalization, the main aspect behind that is interaction. And interaction was a main part of this whole spread as people met through the hospital and the hotel, which spread the disease to many different parts of the world. So thinking about how it kind of traveled, relocation diffusion is the way that it did. And that was just kind of the migration of these people moving from this one place to another place. So, and then this disease was obviously infectious as it was able to spread from one person to another through anything and interaction, which was kind of that globalization aspect. And we'll also talk about this later, that it's a zoonotic disease where it originated from a animal. In this case, it was like a meat product. So, yeah.
Okay, so this is our framework. So just down the middle is one kind of concept of globalization. And so globalization increased travel internationally, and it also increased the population density. And then those two factors will increase transmission rate of a disease, which will then contribute to the disease spread. And then to the left, one concept was the ecology of SARS specifically. So in this case, it's an airborne disease. So that also contributes to the disease spread. And then on the other side of our framework is the resources, treatments, and location of the specific outbreak all will contribute to an increase in accessibility or exposure, which again will lead to an increase in disease spread. So the history of this outbreak, it started in this city in China. And this first major outbreak was in the hospital. And then Hong Kong is a city that's very close by. And one of the healthcare workers that was infected from the hospital stays at this hotel in Hong Kong, which was a super spreader of this disease. So because it was a hotel, there were so many people staying there, and they traveled further to Singapore, Canada, Vietnam, and Taiwan, which all started their own outbreaks, and then in other countries as well. And so this is a demonstration of relocation diffusion because the infected people traveled and took the SARS with them to different areas. So then this is just a map of the outbreak from 2002 to 2003. So the number in blue is just the country's reporting of everyone who had a SARS case. And then the number in red in parentheses is the number of deaths due to SARS. So you can kind of see that the numbers were larger in China itself, and then also in the four countries, Singapore, Canada, Vietnam, and Taiwan. But then it's kind of interesting to see how it did spread to other places, but it didn't really kick off like it did in the other countries.
So we're going to talk about the framework. The first one is ecological. So SARS is a zoonotic disease that was originally transmitted to people by palm civets, which is like a type of animal. And they were being sold as meat in a local market. SARS is an airborne infection. So this sort of like increases how easily it is transmitted from person to person, as opposed to like a disease that needs to be transmitted by touch or something. At the time, it was a new pathogen, so there wasn't any vaccine available at the time of these like giant outbreaks, so they sort of spread kind of uninhibited like we saw with COVID. SARS is also a virus, which gives it kind of worrying properties. So at the time, antibiotics do not work against it because it is a virus, and antibiotics work against bacteria. And then there are also challenges with it being a virus because vaccination is sort of a problem with RNA viruses because they have such a high mutation rate. And then the social framework is basically just like globalization of China. Like we talked about during the late 20th to the 21st century, there were these massive changes. The graph in this slide is an example of that. As you can see, like sort of around the time of the outbreak in like 2002 to 2003, there was like a big increase in manufacturing output in China. So this sort of like represents how quickly China was growing at the time. And with globalization, we sort of saw China becoming a global power compared to since the late 20th century. This quote from one of our papers says, in 1990, a quarter of China's population lived in cities. Today, over 54% are urban residents. So that also shows like how China urbanized. And then with globalization and urbanization and industrialization comes an increase in trade and travel. So industrialization creates like new business opportunities and also an increase in air travel as well.
Kyle, you're muted.
Oh, my bad. All right, so for a spatial framework, SARS is a vector-borne disease, and vector-borne diseases are more likely to emerge in regions with significant animal contact, which is seen in our textbook in page 42. And the sites of the most severe outbreaks were densely populated urban areas in cities like Guangzhou, Hong Kong, Singapore, and Toronto. And a major cause of spread in the beginning of the outbreak was in a hospital in Guangzhou, and the major cause of the international spread was an outbreak in a hotel in Hong Kong. And SARS spread overseas to Singapore, Canada, Vietnam, Taiwan, as infected people traveled. All right, for the economic impact, SARS caused widespread anxiety based on transmission route and little available interventions. Quarantine and travel restrictions impacted tourism, transportation, and retail sales in those countries. And indirect costs driven by public's perception of their risk of becoming infected and consequences of the disease. And then, so this is our case study that we found, this article called "The Economic Impact of Quarantine SARS in Toronto as a case study. And in March 7th, 2003, SARS was found in a hospital in Toronto with an unknown source. And there was a total of 438 suspected cases in Canada, with 224 in Toronto and 44 deaths. And so there was two methods taken, public intervention and no public intervention. So basically quarantine or no quarantine. And these numbers were figured out through estimates of infected people and lost productivity and cost of hospitalization in quarantine. And so they estimated that the provisional government spent $12 million on SARS-related administrative costs, while the estimated cost of no public intervention was $72 million. Despite somewhat daunting initial costs, quarantine saves both lives and money, as we know, but this was a warning back in the early 2000s. Ultimately, the SARS epidemic in Toronto resulted in relatively few infections and deaths. Had the virus not been contained, it could have been spread throughout Canada as well as the rest of the world, with much more devastating results.
So with that all kind of being said, we came to the conclusion that globalization does increase the spread of infectious diseases, especially through relocation and diffusion, especially if this spread of disease is not controlled like through quarantine. Some of the effects of the SARS epidemic was that there were a variety of health improvements, such as hygiene measures, there's new medical technologies, and then new vaccines. But it's still kind of shown that there is room for growth. And then also the effectiveness of quarantine, both economically and in controlling disease spread, as shown through the previous studies that we mentioned. And then we have a Kahoot to play. And that's it. Yeah, so we can show our sources.